Hi, I'm Catherine Boydell, and I'm a professor of mental health at the Black Dog Institute. I'm a sociologist by training, and my work at the Institute is really focused on knowledge translation, so that research to practice gap. So, arts on prescription is one of the elements within a broader rubric of what's called social prescribing, which really is all about creating meaningful connections between people and their communities to really address the social determinants of health and ultimately reduce health inequalities. So when I think about social prescribing, arts on prescription is one of the elements under the schemes, but it could also include lunch clubs or walking and reading groups, support with housing, employment, debt, legal advice, gardening groups, cooking classes, other creative activities. In terms of arts on prescription more specifically, it's actually been gaining some traction lately, particularly in Canada and the UK, where there's a lot of evidence to suggest the efficacy of these arts on prescription programs, not only for enhancing general mental health and well-being, but also physical health as well. The term is a bit contentious in terms of prescribing, and many people have sort of said that prescribing notion is really linked to more of a medical model, when in fact, social prescribing approach in healthcare is really aims to sort of broaden, I guess, the purview of what services and supports might be available beyond the more formal health or mental health systems. We've done a bit of piloting with arts on prescription programs in partnership with Black Dog and the Art Gallery of New South Wales. So this program was targeted to adults with experiences of mild to moderate depression. And they engaged in an 8-week program where each week a group of 16 adults attended the gallery, and for the first hour engaged in 3 artworks. And then the second hour involves going to a beautiful space in the gallery where the participants then responded or were inspired by the artworks to create their own artwork. And then at the end of the 8-week series, there was an installation at the gallery where our participants could invite friends and family to engage with the artworks that they had created. So we found after the group that underwent the intervention that following the program, they had significantly greater mental health and well-being scores than those who had been randomized to the waitlist control group. There was a significantly greater sense of community inclusion, sense of community. A few months later, we offered the program to the participants who were on the waitlist control. Halfway through that program, the gallery was closed because of COVID. So we continued the program virtually and again found similar gains afterwards. So we morphed the program and we offered it virtually in the form of Culture Dose. We offered it to anyone in the community. We had about 50 to 60 people every week for the 10-week run. And again, had some beautiful data from hundreds of participants about the impact that this 1-hour program offered over the lunch hour had on their mental health and well-being. The problem is there are small pockets of work that are being done in different states, and there are lots of data to suggest the important impacts across so many levels, like what it does for the physical health, but also mental health and well-being. There's so much evidence. So many of these programs and services are saying we don't need any more evidence. We've got it. Now what we need to do is scale it up.